you so much for being here for our series called Integrity in Healthcare. And we've known each other, I was doing some calculations, for about 10 years. Our paths have crossed, and I've always respected you and admired you for the work that you do. And so to start, I just wanted to ask you to tell people about your new role and where you're at and what you're doing.
Yeah, so right now I'm working at Doctor's Hospital at the Mental Health and Wellness Center, Serenity Place. We're a 16-bed unit for adults 48 and up who are seeking voluntary inpatient treatment.
Okay. And you have a couple of psychiatrists on staff.
We have 2 psychiatrists, we have 2 therapists.
Okay, wonderful, wonderful. So I want to go back to when you first started and you were getting into mental health care. What or who inspired you or encouraged you to pursue this vocation?
Well, I was drawn to the field. I wanted to be able to make an impact in our community and to help people better understand themselves, their minds, what's going on. And I'm interested in the human experience and all the intricacies that come along with that. So I started working in the field, working in the community setting with supportive housing. Since then, I've transitioned, so now I've been in acute care for probably 6 or 7 years. But I was really interested, in the gaps between those, and seeing some of the gaps in care and some of the opportunities really kind of lit a fire in me to figure out how we can be a part of the solution and how we can make sure that there's good communication between outpatient and inpatient. Recovery really happens at home. It's day to day. It involves the whole person. Medication is really important, but there's a lot more to, treatment than just medication and therapy. So that kind of drew me into the field.
So you're touching on a couple of things, so I'll go to that question. I was going to ask you, what are some of the biggest challenges in mental health care?
I think there's a lot of gaps. It's hard because insurance pays for some things and not necessarily for other things, but I think as a field we're moving towards a more holistic view of mental health and wellness.
Have you found that insurance companies have gotten a little more on board with allowing services for mental health?
I have, yeah.
Okay, good.
And allowing for more broad services and more care coordination and case management. And that really helps because it's a lot of moving parts to put together.
It is, yeah. So one of the questions I wanted to ask you is, what, from when you first started and you've switched gears to now more of an acute setting, what have you seen to be the biggest changes in mental health care?
I think the biggest change would be the more broader acceptance of mental health as a health problem, and mental health care as health care. And there have been a lot of other things that come along with that. The peer movement has been great over the past decade. The Florida Certification Board now recognizes a certified peer recovery specialist. And so that's someone who has lived experience, who has walked in someone's shoes and really can offer hope and a different level of understanding than you get from a clinician. And really including the lived experience in healthcare. They have something unique to offer that's different from a therapist. And it's been a great thing to see the clinical community really embrace that.
And now the peer experience, is that here locally? Is it the state of Florida? Is it national?
Yeah, all of the above.
All of the above, okay.
Yeah.
Perfect.
And it's a great thing. And there's other things that come along with the more wider acceptance of mental health. Mental health care is much more readily available now. From my perspective, it's a competitive landscape, which is a great thing because patients have choice and they can choose their providers. And that's kind of led to a focus on patient experience overall. So we want our patients to feel good about the treatment they're getting, be active participants in their treatment, and have a voice.
And I've worked with a couple of patients that have come out of Serenity Place, and they're now in communities where they live and they're thriving and they're happy with their experience, and they did compliment not only the psychiatrists that were there and the caregivers, but also you personally. So they had a wonderful experience there. So I wanted to share that with you. Let me ask you this. There's always issues that come up in healthcare, and it's getting more and more complex. I've found that we've had to do a lot more education with folks to help them understand and navigate the healthcare, process. If there's, and there's many significant issues, but if there's one significant issue that is so misunderstood in mental health care, what do you think that would be?
I think historically it's been, looking at the clinician as the expert.
Okay.
I think the patient is the expert. They
Mm-hmm.
know their own situation, they have their own goals. And taking medication and seeing a therapist, those are all great things
Mm-hmm.
that should be involved in someone's treatment plan. But there's more to it than that. And I
Okay.
think the most important thing is having that solid relationship and having providers who listen to you and really hear your concerns,
Mm-hmm.
because you're more likely to take the medications and follow up with the
Right.
treatment plan if you were an active participant in it and you agreed to these things, you knew all of the information, expressed your concerns, and were able to find something that works for you.
Good, good. Um, there's one other thing that I want to talk to you about that's kind of a significant issue that I found in my scope in healthcare is there's a big misunderstanding about Baker Acts.
Mm-hmm.
What what can you say to help people better understand what that is? That's a big one.
It's a big one.
Yeah.
So, the Baker Act laws were a great thing. The intentions were good.
Mm-hmm.
The idea was to prevent people from having their rights violated, and
Okay.
that's a great thing.
Right.
Previously, there was less oversight in institutionalizing people and putting them in a facility against their will. So, what the Baker Act laws really did is created better guidance for how and when someone can be placed in a facility, against their decisions.
Okay.
So, involuntarily.
Yes.
So, one thing I think a lot of people don't realize about the Baker Act is that there's also a voluntary portion.
Okay.
And
Explain that. Yeah.
so, first, they need to be offered voluntary treatment.
Okay.
And you can meet all of the criteria of being an imminent threat to yourself or others, and you can be offered voluntary treatment. You can sign yourself in. And then again, it goes back to being an active participant in your own
Okay.
treatment.
Okay.
And people are more likely to have better outcomes if they're,
Yeah.
involved in that decision, versus if, you're met with law enforcement, they cuff you, put you in the back of a car, and then
Yeah.
transport you to a facility. It sets the tone to have a negative experience.
Yeah, and I think that's the image people have in their head. But I want them to better understand that it's a bigger thing than that image that I think people focus on. Walk us through that. What would that look like for a person to voluntarily almost request to be Baker Acted for their safety?
Yeah. So it can come from, a therapist, a person themselves can come forward, and there is a recommended form from the state where you
Okay.
can sign saying you're agreeing to participate in this treatment,
Okay.
and you sign yourself in. And then along with that paperwork is a right to release. So you can
Okay.
say, if I request to leave, I understand that they may need, 24 hours to evaluate me. And then we have 24 hours to have a psychiatrist make an assessment, and determine if they feel like you're safe to leave.
Okay.
If they feel like you're not safe to leave, then it would convert to the traditional BA 52.
Okay.
But if you're safe, where you're not an imminent threat to yourself or others, then you have the right to say, I don't want to be in this treatment anymore, and you can go.
Okay. Excellent. Thank you. And I know we kind of spun off a little bit,
Yeah.
but I was just,
No,
just
it's really
being
important.
in healthcare. Yeah, it is important, and people just there is a stigma to it, and people do misunderstand it. And I just kind of want you to speak to it. So.
And I think sometimes there's this assumption, even among healthcare providers, that if you tell me you're going to hurt yourself or someone else,
Yeah.
then we have to put you in against your will. And that's not necessarily true, because there's still ways to involve people in their treatment and give them some choices.
Yeah. Okay. Thank you for taking the time to
Yeah.
answer that. So another question I have for you, because you are young and you have a career ahead of you, as you've had some behind you and you got a lot ahead of you. What changes, you've already seen some, what changes are you hoping to see or make yourself in your future vocation with mental health care?
I'm hoping to see more coordination of care, better communication between inpatient providers, outpatient providers, better community support, specifically for folks who have severe and persistent mental illness. There are a lot of resources out there now, but I'd like to see them grow more.
Yeah.
I'd like to see better communication, collaboration, the ability to get people seen faster,
Yes.
the ability to have more options for outpatient care. Since COVID, there's been a rise of telehealth, which is
Yes, that's
great,
true.
but it's not for everyone. And
Okay.
sometimes you need that in-person option. So, I'd like to see a really big menu of lots of choices, lots of options
Good.
to fit different needs. In-home care versus virtual versus in-person out at an office. Sometimes just, having someone expecting you to show up is therapeutic in its own way, and being, knowing there's an expectation, I have to get myself dressed, I have to groom, I have to get out of the house, that can be therapeutic for some people. So just having multiple options for care is really something I want to see.
Perfect. And in your setting where you're at, have you found like a kind of an average length of stay for people before they need other resources?
Our average length of stay is higher than I've seen in most other facilities, which is really a good thing. Our patients want to be there, they're actively engaged, they're still benefiting from treatment, but our average length of stay is probably 7 to 12 days.
Okay.
7 to 14.
Good. I wanted to ask you, there's two questions. One, I'm going to ask every person that I interview, but there's another question because you talked about what encouraged you and wanted you to enter this field. There was a phrase that was told to me by a mentor years ago, and I keep it in mind when I'm asked to go see a referral or see a client, is to never be afraid to touch the humanness of people. So if I say that to you, how does that resonate with you?
I think that really resonates with me. You have to connect, and you have to be open to that connection and to receiving, the information they're giving you, and also walking in without a shield up.
Yes.
Being ready to receive. And I think that's really important.
Okay, I wouldn't want to ask you that. So the final question that I'll ask you is what I'm going to ask every interviewee, and that is this question. What does this question mean to you? Would you rather be right or be in relationship?
Okay. So to me, that makes me think of, the historical model as the clinician, as the expert. Versus where we're trying to move and where we're going, which is the patient being the expert of their own experience and really valuing their experience and integrating that into how we care for patients.
I love that answer. I love it. Thank you for sharing that. Thank you for answering my questions and being, here and taking time out of your busy schedule. I know you got a very busy schedule. And thank you for your non-anxious presence. That's definitely felt, and I appreciate it. So
I don't feel it.
yeah. So it's very good. It's very good. So thank you, Emma.
Good.
I appreciate it.
Thank you.